I'd like to welcome everybody today to NHS Halton's Clinical Commissioning Group's annual general meeting, which we are having today in the setting of the Brindley Arts Centre in the gallery space in the middle of Audrey Smith's beautiful exhibition. And what we're having is a conversation over tea, a nice informal chat where we're going to give a lot of information about Halton CCG, about what we've done, and particularly about how we've spent the money. But we want this to be a conversation about health. So to start the conversation, I'd like to go back to our vision, to our really what is Halton CCG attempting to achieve. So perhaps I'll bring Simon into that for understanding that.
Well, our vision is involving everybody in the health and well-being of Halton. So what we're trying to do is ensure that everybody has a stake in their own health and well-being and actually does something about it, to give them the means of doing that and working with others, because when we came together as a CCG some 3 years ago, we recognised we couldn't achieve what we wanted to achieve on our own. We needed partners from the local authority, we needed partners from the provider organisations and indeed other CCGs beyond Halton.
Because we're helped in this, particularly by the information and working with our public health colleagues. And so perhaps I'll ask Eileen to explain an amount about kind of the health priorities that you see for the borough.
Yeah, a few years ago we had a conversation with the public and with the Health and Wellbeing Board and with all our stakeholders. And what we said to them was, what do you feel are the health needs for Halton? And we looked at those, and then we also looked at all our health statistics. And what we came out with as a result of that conversation, which involved hundreds of people across Halton, was our priorities. And with those priorities, what we came up with was mental health, which is our biggest cause of disability in Halton. We also looked at cancer, which is our biggest cause of death in Halton. And then we also looked at child development, levels of alcohol misuse across the borough, and then also falls.
What have we done in this year to try and tackle some of those other issues, and what are our achievements for this year?
Well, I think we've done some really good work around multidisciplinary team working in primary care. And also around ensuring that those multidisciplinary teams include health and social care, so we don't see the join. And I also think we've done really good work around how we commission for complex health and social care needs around the pool budgetary arrangements. So that's given us some real progress in terms of people having care that doesn't see the join.
So pool budgets,
as in the budgets that we have in the CCG for continuing health care and the budgets the local authority has around social care being pooled together, so we spend them together. We get really, really good quality and safe care, but also we get some good outcomes in terms of reducing some of the pressure on those budgets.
I think that's been the journey of the last 3 years. Was a very strong foundation we built that upon, which was the complete, actually, we need to work with you and the local authority better. We need to get away from these discussions over whose budget it is, and by pooling the budget, it's put us in a really good place, and then that's emerged nationally into things like the Better Care Fund.
I think also we've not just looked at integration across adult social care and the CCG through things like our work around the local alcohol action area. We've worked with all our partners, so we've worked with the police, we've worked with the ambulance services, we've worked with local children's services, we've worked with the voluntary sector. And what that's resulted in for us, in one of our priorities, which is reducing harm from alcohol, is we've seen a big reduction in the number of 18-year-olds who've been admitted to A&E with alcohol-related problems. And that's gone from being really high, one of the worst in the country, to being below the northwest average now, and we're going towards the inland average.
Your question was about what have we done well in the last year, and actually what you look at is that bedrock of collaboration, cooperation, co-production with the people actually running the services, We've added some others in. There's about good communication. It's about having a common purpose, and also there's a drive in compassion. So there, if you like, there's Jane Cummings' 6 C's nationally.
Yeah.
We've got our own Halton version of 6 C's about how we work together. And you look at the last year, the opening of the urgent care centres, Operation Emblem, which is a partnership with the Mental Health Trust 5 boroughs and with the police, which has reduced custody by 90%. So these people are now having a mental health assessment, not in a police cell. And that's helped the police in terms of delivering their scarce resource. Eileen brought in Professor Chris Bentley as we developed the general practice strategy, and that was for us a real road to Damascus moment about the importance of health inequalities and where health inequalities are focused in our borough, enabling us to develop with you the joint strategic needs assessment for each practice. And also then it's taking that beyond, so the work that Damien and Mick have been leading on around stroke, and actually having conversations about what good stroke services look like, and doing that in partnership with our neighbouring clinical commissioning groups and the 2 main acute trusts.
I think the other thing, Cliff, that we focused on really well is that although a lot of what we've been doing has been improving processes within our organisations, we've tried to have the patient at the heart of that. Because at the end of the day, we want to make it easier for people to access medical care if they need it. We're trying to put the person at the heart of what we're doing, and the back office that we've talked a lot about so far helps us do that. And some of that the patient will never see, but it will help them to get a better service from the health service and from other health and social care providers. And I think that's at the heart of what we want to do. It's the public that's at the heart of what we're at.
And it brings us back to our values, actually. And of course we've set a world record. We were all on the pitch at the Halton Stadium, where we were all exercising to a video for however long, and we got ourselves in the Guinness World Book of Records. We are on the map as a world record holder, as each individual is here. But the important message about that was about exercise, was about health, was about being positive, fun, which is kind of what we're trying to do here as well. We've got flowers on the table, which growing flowers make you feel happy, make you feel it's healthy activity to do. The cake, whilst if you eat it, won't make you actually healthy. When Liz created it, she's off with a bad foot at the moment, it made her feel happier in the making of it. So if you make loads and loads of cakes, that's good, just don't eat them.
If you do go, get some exercise.
Get some exercise.
And I think that, Cliff, brings us into the progress we've made in terms of excess weight in our children in schools, because we did have a really high obesity rate for school-aged children. And what we've done is we've done something that virtually nowhere else has been able to do. We've actually worked with every single school on reducing weight within those schools for those children, not by going on to them about diet and losing weight, but by actually running with them a healthy food programme so that the teachers are involved, the parents are involved, the kids are part of the exercise that you talked about for the world record. And the fact that all those schools turned up on the World Record Day shows that we've got that really good relationship with those schools. They're all happy to sign up to our Healthy Schools programme. And we're now at the England average for excess weight, which is fantastic. When I remember just 4 years ago, I remember doing a presentation, I was looking at the slides for it the other day, and we were third worst. So so we've really come on.
And I think great support from role models like Witness Vikings. We've used those professional sports people who are engaged with us on healthy eating and lots of other activities that the CCG are supporting through the Vikings. And I think that's about the role models within the community.
But that day really demonstrated what we're all about, because it was really inclusive. So the special schools came along as well, with kids with disabilities and other special needs, and they joined in. Apparently it created such a buzz in all schools, and particularly those schools before, during and in the immediate aftermath of that. So that's about involving people and involving everybody.
And if you think about last year when we did the AGM, we went into one of the local schools and we got two classes of children to make some health pledges, and that was absolutely fabulous because they came up with so we asked them to make a pledge for themselves and a pledge for Halton, and all of them were talking about we want this to be a good place to live, we want this to be a healthy place to live, we want our mums and dads to be healthy, those sorts of things. So it kind of gets it into the psyche of the local people, so that you're in a better place then.
Right, now we come to the real important hard-nosed things. So over to Paul to give us the kind of financial report for what we've done and how well we've done.
Okay. The cake chart represents how we're using the resources that are received in Halton for the NHS. As you can see, the big orange section represents our spending with the local hospitals, Wiston, Warrington and Halton primarily, and they get just over half, 55% of the available money that the CCG gets. The next section is the prescribing done by the GPs. That has just over about 15% of the spending. The next section is our joint work on spending around community care with the local authority and is pooled, which has been mentioned earlier. The next section, just under 10%, is the community health services, the district nurses and the therapists that work in the community. The next section that we have is the green one, and that's our spend on mental health, which gets about 6%. And last is various other services, which includes the management costs of the CCG, which is about 3 million and is about 1.5%. So hopefully that shows that we're not spending an enormous amount on that sort of administrative burden. So that's the cake. I would say as well, an important point is we managed to hit all the government's financial duties and targets, and those were audited by external auditors and our correct position. Okay, so I suppose that sets out that we did a pretty good job in 2014-15, but obviously the key thing is also to start to look forward into the future. And as been made reference to before, it is a time of austerity, and whilst the CCG has had an increase, which is not the same for many parts of the public sector, still it's a very challenging agenda given the fact that we have obviously an ageing population with greater needs, and there are more opportunities to provide new forms of treatment. So I suppose with that we need to look to the future and use that money as well as we possibly can, and do the sort of things referred to before to make that money work harder. So
we can see that that's all the money we've got.
Yes.
So if we want to make new and different things happen, we've got to still stay within that kind of pot of money. So therefore, there's a little bit, or the whole thing is reorganising one section so we can get the right amount of quality for less money, so we can put more money into the other section. And I suppose the notable example of that is our expectations that our urgent care centres, now they're starting to come on stream, and we hope they really will crank up, that orange section will get a little bit smaller, which will allow us to put our community budget, including general practice, a little bit higher. But there's no additional money in real terms coming in where we can say, right, let's start new things. So the world we live in is about transforming things, transforming our services.
So how do you improve the cake whilst it's the same size, really? So what does it taste like in terms of the quality for the person who's effectively consuming it, which is the people we provide get services in for? And how do you, if necessary, change the ingredients in the cake to make it go further or be more substantial when people consume it?
Well, after last night's bake-off, it could be a Black Forest Gatto. But of course the trick is not to have it collapse in your hand.
Or to make sure your fruit doesn't fall to the bottom. So make sure you distribute it. Yeah. We could have actually presented a wedding cake, couldn't we, with tiers, which would actually represent the whole spend on health and care in Halton. There's public health, there's the local authority actions itself, there's NHS England. In the financial year 15-16, we'll be picking up some of the spend around general practice commissioning, so the cake will look different for next year's annual general meeting in 2016.
If we work together more cohesively, we should see a drop in the number of children attending A&E in Halton, more services realigned to maybe children's centres and working with GPs and moving consultants out of the hospital into the community.
It's about shifting the culture so that health prevention is actually everybody's job, and the culture of all our people who are engaging with the public are actually thinking about what that cake might look like in a different way.
I think that's very relevant. It is everyone's job, and what's occurring to me, when you're talking about changing the segments of the cake, having this as a conversation, how many conversations we need in the community to change the habits of a generation or more, which is, I'm not very well, I need to go to hospital, and clearly we need a lot of people talking about new services, the way that we're doing things differently, if we're actually going to make any difference to that sort of way of delivering things and being able to deliver things differently.
Absolutely, and we need to hear those conversations. We need to really hear and work with our communities, our residents of Halton, to really understand how we can transform for the good.
I think that's a real strength of the CCG, is the work that it does around engagement, because it does engage well with its community. It listens to what people have got to say, and we've got lots of examples about where they've shaped futures and shaped services, particularly in relation to children and their emotional health and well-being, the things that they need, coping with the stresses in life. So I think we've got a platform to do it, because the CCG is excellent at engagement.
I think that's reflected, isn't it, in the fact that the mental health for children has improved, and we can see that in the recent health figures. See a real improvement in the number of children having to access hospital for mental health services.
I think there's also something we need to be that's part of the same issue, is really about how we skill people up to manage their own health when they become unwell, so that we give them the ability and the confidence to not always think the only thing they can do is go to an A&E department. Because to be fair, if you're very, very ill, a hospital is where you need to be, but the bulk of time when people are unwell, actually their exacerbation, where their illness gets a bit worse, it can actually be managed in other ways and can prevent them needing to go into a hospital, because a hospital is not always the best place to be. So there is something about how we engage in that conversation as well.
So Damien and Mick, as GPs on the patch, perfectly balanced, one in Runcorn and one in Widnes, and both board members of the CCG. I mean, how does it feel? We know that general practice is really, really busy at the minute. So how does it feel at the minute, and what do you think about the possibilities for transformation?
Well, I think we've already talked about integration with the local authority. I think that's been a major thing on the ground from a practical point of view. That's been really important. It's given us a number of extra options when people have become acutely ill. Instead of just admitting them to hospital when they don't really need to be there. There's a much bigger range of services, and the accessibility of those services as well. The ability to get on the phone and get some help really same day has been really important. Intermediate care and the rapid access rehabilitation service and so on. And also it works the other way around when people have actually had to be in hospital. Getting them out again has been facilitated, and the road has been smoothed for them by the fact that there are very good services available in Halton. I must say, to the envy of some of our neighbouring CCGs, and that's been a real strength, I think, over the last since the CCG came into being, but also particularly in the last 12 months.
Going back to Jan's comment about people looking after themselves at home, We've invested an awful lot over the past 2 years in general practice, looking towards people over the age of 75. And we have got a thread through all of the things that we're doing to join them together. So the big driver in that is going to be the urgent care centres when they're fully up and running. So we're starting to see already in Witness, they're making a big difference to patients, even though it's not fully functioning yet. That's there. It's not quite right because there's a few places, the urgent care centres, for example, are not quite ready yet. But when we can see, I think as a group, we've got that vision of where it's going to be, and I don't think it's going to be that long until we get there. So definitely in the next 12 months. So that an awful lot. Yeah.
So perhaps if we now move and finish our conversation about the future. What does the future hold? What are the directions we need to go in? What are our aspirations for the future? You wanted to jump in, Jan, so over to you.
I just wanted to say something really about... In the last year, and the year for this annual report, we did a huge amount of work, particularly around quality and around safety between the hospitals and ourselves, our communities and primary care.
I think the challenge actually is in a time of austerity and restricted budgets is how to maintain quality and safety, and I think that's going to be a big part of our work going forward, because there are challenges in the system, and Halton CCG has been very good with collaborative working, and that's what it's all about. It's about trying to collaborate, particularly with our acute providers, to make sure that that where their budgets are stretched, we encourage them to maintain quality. It may well be that might involve reconfiguring some services so they might look a bit different. That if you've got a particular condition, you might need to go to a particular hospital or a particular unit which is geared up to specially look after those particular conditions. And I think that's going to be work that's going to be taking place over the next couple of years.
Yeah, I mean, I'm very excited about the future, I have to say. I think there's been some really strong leadership from the governing body in the clinical commissioning group. I think the Health and Wellbeing Board and the political leadership that we've seen has been at one with the leadership that we've seen from the governing body of the CCG. And I think we've put in place some really strong foundations through partnership working and integration. I think the challenge for us now is to build on those foundations and make this something that really makes a difference to people's lives. They've got to play their part in that, and a lot of what we're doing around prevention and early intervention and changing cultures, we've talked a lot about that, is very important. I think we've put our building blocks in place. The urgent care centres, I think, are a major opportunity that we now need to drive forward. So I think we have got a real opportunity that I don't see in other parts of the country.
So ultimately there will be some difficult decisions going forward about how services are provided, by who, where, how we redesign those services, but it's about how we get there, it's about the journey.
So yes, the messages are that transformation is required, and we need to involve everybody in that transformation. A transformation isn't just about talking. It's not just about bringing people together to talk, as we've done today. It's very enjoyable as it is, but it's about the doing, and we need to really keep focused on doing, so that everyone around the table feels the difference, but all of the residents of Halton really feel the difference for the better. So I would like to thank you all for this conversation, which I've enjoyed, and I hope there's something in it that that the people in our communities can take and start to think about and talk about and let us know. And that would be really good and really helpful for the future. So thank you very much.